Happy Nursing Week. Hi, my name is Linda Haslam-Stroud. I'm a registered nurse, and I'm very proud to be the Ontario Nurses Association Provincial President, your provincial president for some 60,000 registered nurses, nurse practitioners, registered practical nurses, and allied health professionals. We are working in many different facilities across Ontario. We're working in hospitals, long-term care facilities, in our community, in our public health areas, in clinics, and in industry. We're a very, very proud professional group of unionized workers across Ontario. Our theme this year is Ontario Nurses, we're here for you. So why do we celebrate Nursing Week? Well, you know what? We're here to honor our profession. We as nurses are the most trusted profession in Canada, in Ontario, and frankly, the world. So let's give ourselves a little bit of a pat on the back. We're honoring the work that we do each and every day with our patients, our clients, and our residents. We're trusted, and we're there providing that high quality care to them. Our biggest challenge, of course, is our workloads and the challenge of us trying to meet our professional standards and provide that quality care. We know that there has been hundreds and hundreds of cuts to registered nurses across Ontario, and we know that for every reduction in RN staffing, that there is increased morbidity and there is increased mortality. Another area that we do have challenges with is violence. Violence in our workplaces, no matter what setting we're in, and I need you to know that that is something that is high on our radar screen that we will continue to address. We represent nurses in many, many different sectors across Ontario. We're everywhere. In our hospitals, we know that we have zero-based budgeting, which is in fact reducing the number of RNs at the bedside. We know that the hospitals, and unfortunately the government's lack of funding, is actually forcing hospitals to balance their budgets on the backs of our patients and on the backs of our registered nurses. We know that we're having nurses removed from caring on the front lines. Our workloads are increasing, and we know what that means then, as I mentioned earlier, to our standards of practice. When we look at long-term care, we're really struggling. The acuity of our residents in long-term care is increasing as they reduce the highest level of educated nursing staff, the RNs. And in fact, as we look at it, we're having RNs replaced. We're also having RPNs replaced, and PSWs are unfortunately being put in a very difficult position in providing the care to our elderly. Community. We have so many challenges that we're facing in the community. Where are we going with public health? The public health nurses being the foundation of healthcare in preventing disease in our communities. Our CCAC members have just gone through a horrendous 17 days of a strike. But guess what? They're back to work. We have collective agreements, not only for the CCACs, but for our long-term care members and our hospital members. Collective agreements that are actually leaders, not only in nursing, but across Ontario, as far as labor relations. So those are positive things that have taken place. And then, of course, we have outstanding collective agreements still out there in some of our clinics, community health centers, family health teams. So it's up to us to really advocate on behalf of our patients and the care that they require. And that's why I'm asking you, as you're celebrating Nursing Week, to also ensure that your patients, the public, and your employer know the integral role that you play for our patients in Ontario. As your president, it's been a privilege representing our highly skilled professionals across Ontario. Ontario nurses, you are there for our patients, our residents, and our clients. Ontario nurses, we're here for you. Happy Nursing Week.